Hello, my name is Jesus Juarez, and now I'll be going over attachment-focused family play therapy for my competency project. For this theory, we have several key figures, starting with Katie Spooner, a play therapist for over 30 years and author of attachment-focused family play therapy. John Bowley, a British psychologist and psychoanalyst who introduced attachment theory. Guy Diamond, a professor at the University of Pennsylvania School of Medicine and co-author of Attachment-Based Family Therapy for Depressed Adolescents. And Gary Diamond, a licensed clinical psychologist and family therapist, as well as the director and chief psychologist at the Ben-Gurion University Community Clinic and the author for Attachment-Based Family Play Therapy for Sexual and Gender Minority Youth Adults and Their Non-Accepting Parents, and co-author of Attachment-Based Family Play Therapy for Depressed Children. And then finally, we have Suzanne Levi, an internationally renowned licensed clinical psychologist and training director of the ABMFT training program at Drexel University's College of Nursing and Health Professionals, and co-author of Attachment-Based Family Play Therapy for Depressed Children. There are several theoretical assumptions when it comes to attachment-based family play therapy, some of them being that the brain is impacted by trauma and attachment. It's important for therapists to understand that those early pre-verbal experiences influence later development in children. Even though the children does not have language for these early felt experiences, these experiences are still wired into the memory of the child's brain. Therapists need to recognize that even if the family members experience the same trauma event, they can each experience it differently. And then finally is the trauma forever changes one's experience of the world and one's neural system. This experience can activate largely maladaptive behaviors, which can become a barrier to forming healthy relationships with others. In terms of the major concepts of the theory, this theory views the problem as children who have experienced trauma and struggle to engage in relationships, behaviors that are healthy to form secure attachments with family members, and later on for healthy relationships. Attachment theory explores how the quality of the relationship influences a child's social, emotional development, emotional regulation, and the ability to form healthy relationships from a neurobiological standpoint. The main goal of this theory is to help relationships among all family members in order for the family to heal and develop resilience, to help parents to incorporate skills which enables them to increase their ability to help their traumatized child manage their emotions effectively and engage in healthy relationship behaviors, skills that will help parents to present in their interactions with their children to establish and maintain a caring and safe relationship. This model talks about SPACE, that stands for structural and flexibility, playfulness, awareness and presence, curiosity, and empathy and acceptance, which I will talk about a little bit more in the next slide. The mechanics of the relationship within the family space framework are the 3 R's of relationship: reflective communication, regulate emotions with the wise mind, and repair relationship ruptures. This theory views functional families as families who are able to cope with their traumas to form healthy relationships and secure attachments with their children. In comparison, dysfunctional families are those where children lack the ability to form healthy relationships, where they don't have a secure attachment with the parent or caregiver and engage in maladaptive behaviors. And then lastly, I just want to make it clear that this theory is not just for trauma children, it is also for children who have experienced experiences behaviors, depression, and anxiety. Moving on to types of clinical intervention, this approach is a directive approach, with therapists following a framework to help families achieve proper functioning. Therapist is applying the family space framework skills parents need to use with their children that will teach parents how to effectively engage with their children. These family spaces house skills, as stated earlier, include structure and flexibility, playfulness, awareness and present, curiosity, empathy, and acceptance. Structure and flexibility skills focus on helping parents create a balance between providing structure for sense of security and also flexibility to maintain a family culture that can adjust to the needs of the child and the stressors of every day. Playfulness helps parents make emotional deposits into the relationship bank with their children. Aware and present, parents will need to understand how resonance circuits and mentalization play a key role in the ability to be attuned to the needs of their children. Curiosity provides a gentle way to explore and challenge behaviors which minimize the intensity of defensiveness. And empathy and acceptance, which recognizes difficulties child might be experiencing and accept a behavior by making sense of the child's trauma experiences and how it can have resulted in those behaviors. This form of therapy consists of four phases of treatment. Phase one is the observational assessment. The focus of the observational assessment phase is primarily to get a sense of the family interaction pattern with little to no intervention by the therapist. Then we have safety and engagement, which focuses on helping family members to develop a sense of security within the change process and commit to the process. Realignment. During the realignment phase, therapists will therapeutically challenge unhealthy relationship patterns with the family. It is important for therapists to monitor the family's ability to tolerate emotional distress. Therapists will need to monitor for signs of emotional dysregulation and association and help family members recognize triggers for those behaviors to aid in the effectiveness of the intervention and pacing of the session. And then finally, we have the attunement phase, which the parents and the children will have successfully identified and replaced unhealthy relationship patterns, creating a safe and nurturing environment in the home. This phase ensures that parents are able to effectively use the skills learned in treatment with their children. Children will be able to use the support in family relationships and demonstrate resilience when challenges occur. Now, it goes without saying that we will definitely be needing some material in order to perform attachment focused family play therapy. There are many materials that could be used for different playful activities with children and parents as presented in this slide. These activities are ways to teach appropriate touch and nurture, and how to ask for permission and much more, such as how to build self-esteem, respect, and positive self-talk of each family member, enhance relationships where each member validates the other person's personal resilience, resourcefulness, and improved communication. Additionally, it allows family members to see each other outside their current roles and to be able to share their emotions and reflect upon the emotions they are feeling. All important factors that contribute to forming healthy and secure attachments. Some examples of the materials are empty cleaners box, paint, stickers, egg cartons, make sure it's empty, emotional charts, balloons and a Sharpie, candy that is long enough such as licorice or fruit roll-ups, clay pot, construction paper, pipe cleaners, markers, and scissors, geodes, and a book such as You Are Special, and a Blanco doll. Just how I'll be needing some material in order to perform attachment-focused family play therapy, I'll also require an office, preferably an office space with a light and soothing color like a shade of green or blue, some plants and soothing artwork to create a relaxed atmosphere for clients, comfortable seating for multiple people, that could be some as couch or comfortable chairs, blankets and pillows for comfort and warmth, and I'll even additionally add a weighted blanket, which could help other clients with anxiety, and some bookshelf to place material. And then lastly, it would be ideal to have a table with chairs for families to do activities on. Moving on to the focus of intervention, the orientation of this model is present focused. The theory focuses on what is happening here and now and how the therapist can help the family form healthy relationships and secure attachment patterns with family members. The theorist order of change is second order change, which focuses on changing attachment patterns within a family, changing function of a system, which is long lasting. This can take up to several weeks. Its focuses on affect and emotions. Trauma is an emotional response, and this model focuses on the client's feeling, affect, and how trauma has affected their ability to form secure relationships and how to repair that dysfunction. And then, additionally, its therapeutic orientation is emotion oriented therapy. It focuses on exploring the client's trauma and the effects it has had in forming healthy relationships and secure attachments. The recommended age of this model is 3 to 17 years of age. The treatment length would depend on the amount of help families and children need to form secure attachments and healthy relationships. That being said, there is no specific length. It will just depend on the child, family, and their needs. Each case and family will be different. The treatment process is a manualized treatment process with 4 phases of treatment that help guide the therapist through the treatment decision-making process. The 4 phases I spoke about earlier in a previous slide, but I'll reiterate that they are the observational assessment phase, safety and engagement phase, realignment phase, and attunement phase. To become an attachment-focused family play therapist, there are some steps to take, such as get a master's or doctorate degree in a relevant field like marriage and family therapy, counseling, or psychology, learn play therapy, complete training in play therapy techniques and child development, specialized training, which includes attend workshops specifically on attachment-focused family play therapy, which can last several days to weeks. gain experience, work under supervision with families and children for about 1 to 2 years to apply what you've learned, and obtaining a license. Get the necessary license for professionals like LMFT or LPC in your area. There is no doubt that diversity is a very important topic to consider, and this model addresses issues of diversity, privilege, social location very well. It discusses about the importance of having a framework for understanding cultural context for racial and ethnic minority families and treatment. It's been found helpful to use a framework of assessing acculturation within families and helping family members to navigate their differing acculturation levels when working with immigrant families. Acculturation is generally understood as a bidirectional process of navigating two distinct cultures in which one culture from their country of origin and that of the host country, such as the United States, intersect across various dimensions of one's daily living, for example, family and home life, school, work, and social domains. It's always important to consider any legal or ethical issues that may arise in therapy. Some of these could be respect, autonomy, non-maleficence, beneficence, justice, fidelity, and veracity. Additionally, obtain informed consent from all family members, clearly define boundaries and confidentiality expectations, recognize and report child abuse or neglect, be culturally sensitive when working with diverse families, and prioritize the safety and well-being of each family member involved in therapy. We can't forget about telehealth, and I had a couple recommendations that we could do in regards to telehealth with attachment focused family play therapy. For example, it could be instead of in person meetings, contact the child and parent individually to talk. It can be helpful to listen and allow family members to vent and share some of their stressors. Approaching these conversations with a positive and responsive stance, such as validating the client's thoughts and feelings early on in the therapeutic relationship, can help clients feel motivated to not only participate in telehealth, but further seek services for their mental health, as this has been associated with lower rates of early therapy, termination. Discussing ways they may get access to telehealth, such as buying a device or purchasing an inexpensive prepaid cell phone, or use the child's school iPad for sessions with permission from the school district if required. Additionally, talk to families to help them recognize how to ensure privacy of conversations to comply with HIPAA and agree on rules of engagement during and after sessions to increase feelings of safety. And then finally, it would be if individual family members decline online services, as a therapist, we must be flexible. Don't try to push unwilling members to join, and instead offer to work with some family members until the others can be won over. I know there might be doubt on the effectiveness and success of attachment focused family play therapy, and for that reason, I have provided some effectiveness research that can show just how effective this treatment is. One is attachment family play therapy's theoretical clinical model outcomes and process research that found that ABMFT is successful for adolescents suffering from depression, with a significant increase in increasing family cohesion and perceiving attachment. Additionally, we have attachment-based family pet therapy in the age of telehealth and COVID-19. ABFT helps families develop healthy coping mechanisms and improve or form healthy communication styles, a key factor in forming secure attachments. And then finally, attachment-based family therapy for depressed and suicidal adolescents, theory, clinical models, and empirical support, which demonstrated that depression and suicide ideation significantly decreased after ABMFT treatment. The reason I am recommending this program is because I strongly believe many individuals lack the ability to understand their emotions. They may be able to label what they are feeling, but not identify the reason behind those emotions. This leads to them developing poor coping mechanisms and communication styles that are passed on to the next generation, leading to further issues with parents being dismissive and children not learning healthy coping mechanisms and communication styles that affects their ability to make and maintain healthy relationships, and furthermore cause conflict within the family and children and the parents being disconnected. Lacking secure attachment is crucial to developing, and this approach will help improve family dynamics, child-parent relationships, and reduce symptoms of depression and suicide in adolescents. I'll finish my presentation off with providing you with a couple of resources and references. Thank you for watching. If there's any questions, please feel free to let me know. Have a good one.